Karnataka yesterday recorded the highest number of cases, over 14,000 cases recorded, and this is the highest since Jan 2021 is what we are told. Bangalore alone has recorded more than 10,000 cases. So the government has now called an emergency meeting at 9:30 this morning, and I'm coming to you from the health minister's house here, residence, and he also visited private hospitals yesterday to take a status check as to how many beds have the private hospitals allocated. 50% is the number that the government has told the private hospitals to make sure it's mandatory to give to the patients who come out here. Karnataka also has called an all-party meeting on the April 18th 4 p.m. to see the opposition's opinion and then take up further action. The sources within the government are saying this, that the government is contemplating on weekend lockdown, just say the same way that Delhi and Rajasthan has implemented. Karnataka too, there's all chances that this might be implemented is what we are told. But however, an emergency meeting has been called now, and there's election also in Karnataka tomorrow. 3 by-elections in Karnataka. Till now the chief minister and other ministers were all in the constituency campaigning, but now the COVID numbers are on the rise, and health minister too has taken a status check from the hospitals and from the control room yesterday. 14,000 odd cases in Karnataka, 10,000 odd cases in Bengaluru, and it's a high time that the government acts is what the people on ground are believing, and hence 18th is the all-party meeting. We'll have to wait and watch if some big curbs is coming in the way to Karnataka. Nagarjun Dwarkanath for India Today.
For the last several days, on a daily basis, more than 5,000 cases of coronavirus were being reported out of Rajasthan, and the numbers at the various testing centers have also gone up. You can see at this CMHO center, the number of people who have turned up for getting themselves tested. There is a huge line which is currently there to ensure that the testing can get done. And there have been several complaints also of people mentioning that there have been delays of more than 72 to 96 hours of people test reports being given to them.
जो हम सैंपल भेजते हैं वहाँ कोई मशीन की प्रॉब्लम भी हो जाती है कई बार, तो मोस्टली तो टाइम पे आ जाते हैं, 24 आवर्स में ही आता है, कभी कभी लेट हो जाता है.
तो टेस्टिंग जो बड़ी है उसकी वो भी कारण है क्या?
वो भी कारण है. पहले से प्रेशर ज्यादा है. ड्यूटी टाइम तो यही था, लेकिन पहले 5 से 5:30 तक फ्री होते थे, अब तो 7-8 ही बजते हैं.
That the reports of coronavirus tests come timely and if needed, so that people can get the required treatment in time, so that the spread of the virus can be limited. With Nikhil Sharma, Devankur Vadhavan in Jaipur, India Today.
There seems to be no end to the horror stories coming out of the country's hospitals. There is shortage of beds, oxygen cylinders, healthcare infrastructure now crumbling. Let's take a look.
This is the sound you hear now in almost every hospital. Families sobbing as they lost their loved ones to the coronavirus. This is the family of an ex-serviceman who died at the hospital doorstep. He waited for hours for help, for medical intervention, but nobody came. He passed away at the door in the scorching sun.
बोले भी कि पापा को अंदर एडमिट कर दीजिए, उसके बाद जो करना, तो धूप में छोड़ दिए पापा को. हम बोले थे कि अंदर कर दीजिए, धूप में बहुत लो हो गया पूरा. लास्ट में पापा हमारे नहीं.
This tragic scene played out as the Bihar Health Minister visited the hospital and the group of senior doctors was busy accompanying the minister.
बेहतर स्वास्थ्य सुविधा देने का कोशिश और प्रयास हो रहा है. अस्पतालों में निश्चित रूप से विगत कुछ दिनों में अचानक से संख्या बढ़ी है और इसीलिए स्वास्थ्य सुविधाओं को बढ़ाने का लगातार प्रयास हम सब कर रहे हैं.
मंत्री जी यहाँ पे डॉक्टर चिल्लाते रह गए, डॉक्टर चिल्लाते रह गए, कोई डॉक्टर नहीं आया, कोई डॉक्टर नहीं आया.
Unfortunately, you can hear these cries for help outside almost every single hospital right now. And this tells you better than any statistic that our healthcare system is crumbling amid the second COVID wave. There are no ambulances left, And that is why bodies of COVID patients were transported in a garbage truck in Chhattisgarh's Rajnandagaon. There are no hospital beds, and that is why this 70-year-old man was administered oxygen in his car in Lucknow.
The major problem is of ventilator beds. Many patients are requiring ventilators, but the ventilators are not available in adequate quantity. So what basic issue is, whenever some patient is very bad, it is very difficult for us to manage that patient on emergency basis.
But can we really blame hospitals? Our healthcare workers are working round the clock, putting their lives at risk to accommodate patients. And that is why hospitals now are bursting at the seams, with patients being taken care of even in the lobby. Meanwhile, the administration has another issue to address, and that is vaccine security. Amid reports of vaccine shortage, batch of 320 doses of Bharat Biotech's Covaxin has been stolen from a hospital in Jaipur.
वहाँ से वैक्सीन की वायल चोरी होना एक बड़ी घटना है। संबंधित अधीक्षक को जांच के निर्देश भी दिए कि जांच करके बताएं कि संबंधित कौन दोषी है, उसके खिलाफ भी कार्रवाई शुरू की जाएगी, ऑफिशियल कार्रवाई शुरू की जाएगी और उसके खिलाफ जिसने चुराया उसके खिलाफ एफआईआर लॉन्च कराने के निर्देशित कर दिया गया है।
Amid the monster COVID surge, our hospitals are struggling to cope. Countless lives have been lost due to lack of apathy and due to clear negligence. Bureau Report, India Today.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.